Joining us now, Tamil Nadu's Health Secretary Dr. J. Radhakrishnan. Doctor, thank you very much for your time. It's fairly a few weeks after Tamil Nadu opened up in terms of resumption of transport. Still we witness around close to 6,000 cases every day. What are the key challenges now, Doctor?
See, the key challenges now have been that now that we have opened up all the workplaces earlier which were working either partly, selective workplace, now all the workplaces are there. So we have to ensure that everybody follows the standard operating guidelines for those workplaces. Second is there is a general tendency. See, one thing is that we were getting almost close to 7,000 cases for 50 odd thousand tests. But Tamil Nadu, now we do almost 85 to 90,000 odd tests and we get around 6,000 odd tests. We look at positivity more than the number. Right. Number is not, we may do 1.5 lakh tests and if we get how the positive. So that way when we look at even now we have cause of concern in and select zones of Chennai, Annanagar, Ambattur, Adayar and Perungudi kind of zones. Then we have surrounding Chennai, immediate industrial belts of Chengalpet, Tiruvallur and also part of Kanjipuram. Then again, wherever the disease was not there much, for example, the western part of Tamil Nadu, there again we have a kind of surge. So everywhere we are doing 10 times the test. But most important challenge which we are facing now is an attitudinal, behavioral change has still not taken place among people. That fear which was there slowly seems to be getting out. That's why we have started this fine system aggressively.
We had aggressive testing, we had hundreds of fever clinics opened up. Still, we have contained the spread, but the numbers still hover around 5,000 plus. Is there a need for a change in strategy from the health department point of view?
No, see, first we have to understand that whatever number comes is an aggregate of various districts, and even in sub-district level there are issues. So just like in the country we say that not all, when you give a country's figure, not all states are equally affected. Similarly, not all districts are equal. Even here what we find is, within Tamil Nadu, there has been ups and downs. Right. Chennai was once upon a time around 2,400, it has come down to around 1,000 odd figure. Neighboring districts were 1,300, which has come down to 800. But Western belt, which was giving far lesser number, is now getting close to 1,200 to 1,400 numbers. So by and large, what we gain in some districts, what we learnt in the entire exercise is that slowly as we go to block level and all, we have identified 6 or 7 odd districts where the number of cases are consistently above 150 per day, and positivity, though in Tamil Nadu everywhere positivity has come down below 10, there are select 9 districts where it is between 10 and 8. So these areas we are, apart from aggressive testing, we are also looking, we are ensuring that this contact tracing part is not forgotten. We get the contacts traced, isolated, tracked and done, plus the micro containment. Right. That is where, as we enter this phase, people tend to take the containment also casually. Right. So that we are actually strategically using police and local body and volunteers to ensure that this micro contained area, maybe in a group of 6 to 7 streets, there they need to take it seriously. We constantly are appealing to people that please understand that don't compare yourself with a neighboring state, neighboring district, neighboring place and assume that you are at a casual thing. Similarly, we have seen individual spurts in Resident Welfare Association of large apartment complexes. Right. Mainly after somebody attending a gathering or and similarly shops outside religious centers. These are all areas where it is a work in progress.
There are also some reports that the death numbers, particularly in government hospitals, are being managed. For example, people who may test negative beyond a point, when they die, they are being taken as negative patients. Is that something being done to show that the death rates have come down in the state?
No, Tamil Nadu, if you remember, when we started, the doctors were showing, declaring deaths due to COVID. And comorbid also, initial phases, if I remember. That's why we put a reconciliation committee. Government declared additional 444 odd deaths. Now, clearly what we are following is ICMR guidelines. There is a WHO guideline and ICMR guideline which clearly says how a death should be. If it is a positive patient, it has to be COVID irrespective of the incidental or antecedental cause of death. We cannot, immediate cause of death may be something, antecedental cause may be something, other significant cause may be something, but then if he is a COVID positive patient, declare as COVID. If we test negative, but there are clinical signs, it is epidemiologically, clinically, we have to say it's another category which it doesn't get declared as COVID death, but it's a different category. Then where test related is awaited, it is suspect COVID, and test inconclusive, probable COVID. So that basically we are doing a lot of training, but ultimately these now everywhere that strict compliance to ICMR guideline has been, that is why we went up to 129 deaths per week from a range of 10 to 20. Even now our deaths will be in the range of roughly around 70 per day. And the number of hospital treating, so that itself is a big number, and our focus is to bring it down to around 1. Our issue is irrespective of COVID or non-COVID being caused, if it is a preventable death, it has to be prevented. That should be the goal, and not necessarily looking at number of deaths due to COVID is come down, but deaths due to some other cause. That is why we have, even now just we had meetings of Dean where we said very actively the non-COVID cases and non-COVID activity also has to be brought to full swing.
So numbers are not managed that way to show it up.
Definitely not, and even if there is some error at some place, again there is a permanent reconciliation committee to correct it.
And doctor, the state introduced a fine system for people who violate wearing of mask and social distancing. How does it work?
No, it definitely, see, the intention is not to collect fine, but what we find is, the other day I went to markets, bus stands and all, that element of casualness has been there. That is why throughout the state so far roughly around 55,000 odd numbers of individual and institutions have been fined. They have collected around 1.2 crore rupees. Intention is not the money about it, but making them understand that they are not only putting themselves at risk, but they are putting others at risk. So that is where I still find when we went to Tirutani part of it, some of the rural areas and semi-urban areas, even now that they think that this is just so many. That is why we are not focusing so much on telling the discharges. Tamil Nadu has one of the highest discharges. So that we found sometimes the messaging wise they tend to think that okay, everybody is going to get, at some point of time everybody is, except those who die, they will get discharged. So we are focusing more on these numbers as far as mortality is concerned, not even percentage. So that people understand that just because of somebody's casualness another man can die or he himself can die. And this delayed present, our other challenge has been, even now despite our best efforts, elderly people considering that the COVID dispersal of bodies, they feel that it may not be COVID, so they delay. So that also aggressively we are doing an IEC campaign to tell them that COVID, if you come, more than 95-year-old people, so many people have got cured. So don't avoid testing till your lung involvement or things become high. And clinical side also, definitely we need to appreciate doctors have really worked out a number of protocols for clotting issues, cytokine storm issues, comorbid issues, and parallel add-on therapy with Indian medicine. So they have also been doing the doctors, nurses and paramedics.
Lastly, is there also a need to let COVID testing possible without doctor prescription?
See, that is a very big myth going around that only doctors. See, today when we do 90,000 odd, around 85,000 to 90,000 odd tests, obviously everything. See, when you are doing, every fever camp is not run by a doctor. It can be with a paramedic. So we are allowing people in Tamil Nadu. We are in the next stage. We are even keeping collection centers at PHCs. Okay. That's for every 30,000 people can just walk in. So Tamil Nadu took that WHO and the Government of India guidelines, and we said even if somebody has one symptom, we will test. It is not that he has to have this symptom. Right. So this kind of in a lot of WhatsApp incorrect news, then tests give false results so that people can be admitted. For every patient, people are getting some money. Those kind of the repeated messaging we would like to give that don't believe WhatsApp rumors. Then don't decide on niche. Everybody seems to be a doctor. Right. Even I am a secretary. I go by what the experts say. So we have to have that humility to understand that it is it has to be medically decided, not based on what forward you get in WhatsApp.
Thank you so much, Doctor, for your time.
Thank you.
That was Dr. J. Radhakrishnan, Tamil Nadu Health Secretary, talking to us in Chennai with camera person Edwin, Sam Daniel. for NDTV.